I'm here today with a topic that's very exciting and is a lot of fun to dive into. Hidden secrets nurses don't like to spill. Shh. I am just sharing 12 things I wish I knew before pursuing the profession of nursing and before deciding to become a nurse. This is in no particular order, and it's what I have personally observed, learned from other nurses, experienced, or adapted. If you are considering nursing or are in the midst of it and want a heads up as to what you are signing up for and to have a realistic expectation, this video will help you out immensely. By the way, if you're new here, my name is Paridhi and I'm a new grad nurse with an upcoming NCLEX licensure exam, a newbie YouTuber, a wife, and a mom to two gorgeous little girls. I make videos about nursing, personal growth, and motivation, and all things mommy, where I share my knowledge, experience, and tips and tricks on everything I've learned along the way. So if you enjoy today's video and get some value out of it, consider subscribing. I would love to have you. So let's dive right into the cool parts and the not so great parts of becoming a nurse. Here we go. Tip number 1. Nursing involves a fair share of not so glamorous and messy things. You deal with a ton of bodily fluids, blood, vomit, open sores, nasty wounds, stinky feet, gross sputum, bunches of feces, and dealing with terrible infections and extremely sick, vulnerable, sad, and frustrated patients at times. Tip number 2. Thankfully, I have had only positive and beyond amazing experiences with nurses who I shadowed during all of my clinical rotations. But the saying, nurses eat their young, is there for a reason. There can be a culture of substantial hazing, bullying, intimidation, and conflict of new nurses or nursing students at the hands of their more experienced co-workers within the workplace. But this type of behavior is not necessarily unique to nursing. It is fairly common in other professions as well. But essentially, it refers to seasoned nurses bullying new nurses. There can be name calling, playing favorites, verbal abuse, or radio silence, etc. Tip number 3. Patients can be rude, disrespectful, even aggressive with you when you are one-on-one for 8 to 12 hours straight. I've seen dementia patients get out of control, scream, bite, spit, hit the nurse or CNAs, verbally abuse you, get naked, ask for drugs. Sometimes it's not a pretty scene. Tip number 4. New nurses are mostly offered night shifts and are on mandation, where you are forced to work if the hospital is short-staffed. Basically, more hours can be added after you end your shift, and you are forced to have a much longer day than you had planned for originally, which can be challenging if you have other plans or are already tired and looking forward to being done for the day. Tip number 5. Bedside nursing is exhausting. You are on your feet for 12 hours straight, and with the commute and everything, it adds up to a long day. It can be really hard on your body. Tip number 6. Hospitals can be understaffed, and hence the ratio of nurses to patient increases. At the hospitals I have been to so far, it's usually between 3 to 5 patients per nurse, which is pretty decent if your patients are mostly stable. But if you have patients with fall risk or patients that are confused and try to get out of bed every few minutes or are extremely dependent, basically patients who need 100% assistance, it can get overwhelming, exhausting, and more importantly unsafe for the patient and increase your chances of making an error. Tip number 7. Nursing burnout is real. If you constantly feel fatigued, take infrequent breaks, feel overworked, or physically and emotionally exhausted, and there's no substantial management support, it may lead to nurses leaving bedside nursing, or changing professions, or seeking more advanced practice nursing. Just something to be aware of and keep in mind when making your decision to become a nurse. Tip number 8. Document everything that happens, aka chart. It's just good nursing practice, plus to avoid professional negligence lawsuits or medical malpractice that you might need to show up decades later. Nurses are trained to document every aspect of patient care under them. Very early on, we were taught that if something is not documented, it's as good as it never happened. Tip number 9. Nurses do not call all the shots. You as a nurse are in the driver's seat all day, every day. But any changes that need to be made on your patient's orders or a new diagnosis need to be made, you have to switch to the passenger seat. You don't have a lot of autonomy in that sense. Tip number 10. You as a nurse have to advocate for your patient, and it's on you to touch base with the appropriate healthcare professional to make things happen or recommend a change in treatment or medication dose if you deem important or express a concern, etc. Basically, healthcare is really collaborative, and so is nursing. No one does a standalone job in healthcare. Tip number 11. Not all doctors show nurses the most respect. Some physicians can be outright rude and dismissive. This is a hard truth. On the other hand, some physicians are so great, they are collaborative and respectful and share the common goal of best outcome for their patient and are willing to answer questions or follow up and patiently listen to the nurse's recommendations and suggestions as they should. But I have seen doctors hang up on nurses or ask them not to call back regarding, for example, some specific thing. But as a nurse, you need to stand up for yourself and be your patient's advocate and make sure the only thing driving you is a good patient outcome in the end. My last and final tip for you, tip number 12. The schedule, especially for new grad nurses, can be challenging the first few years and sometimes even longer based on seniority, with having to work nights and holidays and weekends. I would think even after once the novelty of just joining as a brand new nurse wears off, you will continue to possibly miss special family occasions or celebrations with friends or having to work nights and then sleep during the day and not see your family that much, depending on yours and their schedule, of course. I mean, every profession comes with its foundational hardships, but it can be slightly challenging to find a balance between switching night and day and to adjust to a big lifestyle change like that. And that pretty much does it for this video, guys. I hope you enjoyed it. Thank you so much for watching. Please leave in the comments below what you wished you had known before becoming a nurse, or things you have found along the way which came as a total surprise to you. I would love to know, since I'm barely starting here myself, plus it's going to help someone else out. And before I let you go, I know this video talked about a lot of negatives and hardships that come with the nursing profession. But I want you to know that I'm absolutely in love with nursing. It's hard, but it's totally doable. Just do it for the right reasons. Don't let any of this deter you from pursuing nursing. But personally, I'm a big fan of going into something aware of what I'm signing myself up for. That being said, I would encourage anyone interested to get into it and join the profession. Despite its hardships, I would say there's nothing more rewarding when a patient or their family profusely thank you for saving their life or taking care of them. All the hardships become so worth it. Choose the path that resonates with your authentic self. Live life on your own terms and pursue something you truly love and are passionate about. Even if it's exhausting, non-stop, stressful, and overwhelming sometimes, I go to bed content and happy with a big smile. My purpose, determination, and grit make me feel alive and accomplished, and I would have it no other way. Since we are on the topic of becoming a nurse, here's what being a nurse means, which is expressed beautifully by a fellow nurse, Melody Shenwert. She sums up nursing perfectly. I want to read that to you here. You'll never be bored. You'll always be frustrated. You'll be surrounded by challenges, so much to do and so little time. You'll carry immense responsibility and very little authority. You'll step into people's lives and you'll make a difference. Some will bless you, some will curse you. You'll see people at their worst and at their best. You'll never cease to be amazed at people's capacity for love, courage, and endurance. You'll see life begin and end. You'll experience resounding triumphs and devastating failures. You'll cry a lot and you'll laugh a lot. You'll know what it is to be human and to be humane. So guys, if this video was helpful and empowering to you, and if you got something out of it, hit that like button and consider subscribing. Or head over to my Instagram, which is @Paridhi Badjatiya, where I post a lot of little gems that I'm learning every day. plus motivation and cute pics and shenanigans of my little baby girls. Let's chat in the comments below or on my Instagram. Love you guys. I really appreciate each and every one of you. Can't wait to get to know you all, and I'll see you guys in my next video. Bye.